Okay, bike pictures?
No, no,
Okay, I know what you want. You want a new phone, right?
no. But how the hell do you know about this?
Let's see. I'm all ears. I can see, bro. Okay, let's cut to the chase. You want no. Yeah, guess what? You need a new haircut. Yeah?
No, no, shut the hell up. I don't
Okay,
want.
okay,
Can
okay,
you please
okay,
search it? I'm
okay.
having a severe headache. Can you please
Okay.
at least search that?
Okay. I can do that. Searching. Did you mean migraine?
Oh, migraine.
Guess what? I found this too. Did you mean tumor?
What? Tumor? No,
Oh,
what
oh,
the hell?
okay, bro. Final diagnosis. This. Did you mean death?
What? What the hell? What are you talking
No,
about?
okay.
Forget it,
Okay.
leave it.
Okay.
Actually, I'm having a little bit stomach pain too. At least can you please search
Oh,
that?
okay, bro. Okay. Don't be angry. I can do that. I can. Searching. Did you mean migraine?
What? What the hell are you talking about?
Tumor?
Leave it, forget it.
Okay.
Refresh,
Okay.
forget it.
Okay.
Actually, yesterday my friend was having a leg pain. At least can you search that? What is the cause of leg pain?
I can do that. Just simple, bro. Just simple. Did you mean migraine?
No, forget it. Shut down. Forget it. Shut down.
Oh man. Yeah, jokes apart, guys. Hello, hi everyone. Thanks for joining, you guys. And we did this skit, like small skit. We'd like to mention this skit in a while. So before we kickstart this today's program, Vanakkam, Vandanam, Swagatam, Namaste, Magandangumaga, good day and good morning, everyone. So I, Samuel Sam Jr., one of the international clerks in our Jonalta Foundation School of Medicine, and one of your hosts today, I'd like to welcome each and every one of you to this special event.
And I, Sharma Mayank, same as Sam. I'm one of the international club and Jonalta Founder School of Medicine. And I'm your other host for today. And I'm extremely pleased to welcome each and every one of you in this special meeting.
Yeah, we're here on behalf of our fellow clerks who've been working with us in this Department of Preventive Medicine and Community Health. Together with our team, we've come forward and put up with this amazing webinar of Dr. Google self-prescription.
As you all saw the skit earlier, in today's webinar is all about awareness and consumption of self-prescribed medication online, and to which we exactly online searches leading towards medically.
Yeah, we'd like to extend our sincere gratitude to our mentors and faculties from our department, Dr. Audrey Andres and Dr. Eldre Navarro, as they have been helping us organizing this small initiative under their regulations.
And please don't hold on to your webinar up close, as in the end, we would like very much to hear from you guys. And for so, our panelists will welcome all your answers and all your queries. All you have to do is just type in your questions to the direct message with the account name Q&A. An important note, do not forget to participate in our random lucky draw, in between for which you'll get a chance to win a grand prize.
Yeah, so you guys ready? Yeah, I hope you guys ready. Hope this session will change some perspective that you guys all have about getting prescription by Google. So once again, this is our webinar of Dr. Google, where cure doesn't lie in a single touch or click. So please, let me take you all to our today's itinerary of this webinar. So we'll begin with the introduction and the national anthem of both India and Philippines, and opening remarks by Dr. Audrey Andres, and random lucky draw and guide video presentation, interviews with our senior doctors, Q&A session, where the place you guys get to, we guys get to answer the questions you are going to ask, and closing remarks by Dr. Eldre Navarro.
Okay. Yeah, I get it. This is so much for a webinar to solo, but trust me, guys, we'll try our level best to make you guys interested in this journey.
Yeah. That's in our job. Okay. So we have to mention this, guys, that the content which we are using in this webinar is completely for educational purposes only and non-copyrighted materials. So with all due respect, do not copy or use this content for your personal uses. Yeah, thanks. So before we begin, a small contribute from you guys. Yeah, that's wrong. Not about your money. So this contribution is you guys all are gonna do just to type in a chat box that you guys are happy, the word happy. If you would, that would be very much appreciated, guys. So since our beloved co-clerks put up with this initiative that they were always more than ready to lend their support in making this event happen. It wouldn't have been possible without the support of them at all. So may all be type the word happy in the chat box as a token of encouragement for all the effort and works, guys. If you guys are happy, then we are more than happy. Let's put a smile in everyone's face, guys. Thank you, guys. Thank you for the amazing responses. Thank you. Thank you guys for the amazing and astonishing responses. We've got a wonderful audience, I guess, I presume.
Your audio is off.
We're so sorry for the technical glitches, guys. So yeah, I apologize for the technical glitches, the hosting. So without further ado, let's begin with paying our uttermost respect to both the Indian and Philippines national anthem.
Mga kababayan, ang pambansang awit ng Pilipinas. Kayang mag-ibig, kaya sa sinakanan, alam ng puso, sa dikit mo'y buhay. Lupang hinirang, kuya ka ng mag-ibig, sa manlulupin, di ka pasisigil, sa nagatang tutok sa simoy at sa langit ng bangao, ay hinatang
That was really, really lovely. Now we'd like to invite our department head, Dr. Audrey Andres, for the opening remarks and her thoughts.
Okay, good morning. So let me welcome you to the public health lecture of our international clerks for preventive medicine and community health. They could have chosen a much more timely topic than what we will tackle this morning. So we will have Dr. Google, self-prescription when one click would not give us a cure. So now we often encounter patients or clinic or asking us clinical questions, but already we are not the first doctors that they've seen. Who have they seen? They first consulted Dr. Google, and we often see them at the clinics. They have made self-prescription, they have done self-remedies at home before they go to the clinic. And when would the internet or information technology is not bad, okay? But as educators, we doctors have our role as educators as well. We should also teach our patients and create awareness on when this information can be used so that as not to delay any health interventions. And this is important, as you will know, in a lot of diseases, time is of the essence. And any delay of diagnosis or any delay in treatment would have a lot of repercussions. So I would not keep you long, and I will give the floor to our students who have worked hard for this public health seminar. Dr. Google, self-prescription when a cure would not be obtained with just a single touch or click. Good morning.
That is so true words, Doctor, that you described about our topic. And thank you so much, Doctor, for the heartwarming expressions and thoughts you put.
But before we get into some serious stuff, educating stuff, let's get ourselves entertained by random lucky draw. So there will be 3 people among you from the audience who will stand a chance to win amazing cash prize of 500 pesos just to join this session.
500 pesos. Really? Seriously, mind?
Yes.
Can I join?
No way, dude. No.
Bro, we'll take 50-50.
No. Forget it.
Bro,
Forget
I'll give
it.
you 60%.
No, forget. Okay.
My God.
So, and a humble reminder to you guys, don't forget to type happy in the chat box to participate in this random lucky draw.
Yes.
Your participation will get you rewarded.
And in order to claim your cash prize of 500 pesos, you must provide your name, place, whether you are staying in India or Philippines, you have to mention that, and contact number, so that our team will contact you regarding this. And if you fail to respond within 10 to 15 seconds, then we'll move on to some other person. Sorry. So now, let's see who are those lucky people. Shall we? 3, 2, 1, spin. Wow, 500. The first winner is Atul Singh. If you happen to be here right now with us, can you please note yourself, like say, hey, I'm here. Hey, hi.
Send your message, send your name in the chat
Yeah,
box.
your name and your place and contact number. Yeah. Can we hear from Atul Singh? Atul Singh, everybody? No? Okay, let's move on to some other person who deserves. Yeah. 3, 2, 1, go. And the next winner for Anish Babu. If you happen to be here, Sivakumar Anish Babu, if you happen to be here with us in this meeting, can you note yourself? Like say, hey, I'm here, or your name, anything? Okay. Okay, can we move on to some other person? Can we move on to some other person now?
Okay.
3, 2, yeah. Whoa!
Sharma
Oh
Mahesh.
my God, Sharma Mahesh. Yeah. Now we'd like to announce you guys. He'd like to donate this 500 pesos to some
So-
other person.
So actually, the Sharma Mahesh is from
This-
with us. So
This
he'll
is a
be-
surprise, guys. This is
So,
a
yeah.
surprise. This is not made up, guys. Our hands are clean. This is not made up.
yeah. So he will be donating this money.
Okay. Okay. Let's move on to some other person now. Yeah. 3, 2, 1. Singh Jivraj. Yeah.
If you are here, can you please send
Yeah,
the
if you
text
happen to be
message?
here, Singh Jivraj, we are very much happy to announce that you won 500 pesos right now. You can get it from us, like to mention your name and your contact number so that our people will contact you.
Okay. I already got a message from Jivraj.
Yeah.
Okay.
So,
Mahesh, Jivraj, and the one last person.
okay, that's last person. Nafisa Kar. If you happen to be here with us in this meeting, you can claim your prize just to respond. Yeah. Okay. Okay. Thank you, guys. Thank you. Thank you. You've been a wonderful audience. Now, let's move on to the guide video. So this is a guide video of what we're going to learn today. So this video is like an outline, guideline, and introduction video of what we really want to tell you guys all about. Yeah, let's watch the video.
Repeat. Kitchen.
So how was the dinner?
He's doing good.
What are you doing?
I'm watching this video. Look.
It's good.
Yeah. What happened?
No, I have elbow pain from morning.
Let's go and see doctor.
No, it's okay. I will check it on the Google. Huh?
I'm tired. I'm going to sleep.
No, you sleep. I will just search it on the Google and I will sleep. Huh?
Good night.
Okay, good night.
Good morning.
Good morning.
I'm late for work.
Dear Nina, I'm writing you this letter because it was too hard to tell you in person. I found out that elbow pain is a direct cause to death and that I now have 24 hours to live. I want you to know that I love you, but with my remaining time, I must find my purpose. But the more I think about the idea of purpose, the more silly it seems. And the materialistic things,
Oh, hi bro, how are you? I'm good bro. Bro, actually I want to give you this my favorite guitar. You have it, huh? Why bro? It's okay bro, I just want to give you have it. Are you serious? Yes bro, I'm serious. Are you 100% serious bro? I'm alright bro. Okay bro, thank you so much. Hey, today we have a different party.
instead, just loving life itself is enough. We always look forward to what's next, but forget to enjoy what's now. And the little things in life are actually the most important things. They say life's like a box of chocolates. Well, it's also like a bar of chocolate. and you should enjoy each bite and savor each piece as if it's your last. I also really just like trees, and I want you to know that they feel so good. I've accepted that my time has come, and I'm ready to go. And now that I know the true meaning.
Wait! You're not going to die.
But I searched on Google like an elbow pain person can die in 24 hours.
No, I have already explained to doctor.
She told me everything. What happened? You just hit your funny bone. It's just a common injury. I will give some medication. You will get better already.
Really?
Yeah, really.
Okay, let's go home.
A few moments later.
Hey bro, I need my guitar back, bro. Why, bro? I want it. It's mine, bro. You give it to me, bro. Just give me. I want like it, bro. Wait. But why, bro? I need this. Give it to me, bro. I enjoy this, bro. Hey, cancel the party.
Okay. I hope you guys enjoyed the video. So before we move on to the video presentation, I would like to ask some questions to you guys. You can type in your answers in the chat box.
You can type, guys.
So what do you guys think? What's the world's largest building?
Taj Mahal.
Please stop it.
No.
Guys, type it in the chat box.
I know. Tamaya Tower.
No.
Okay. LIC building. No. I know this answer. I'm sorry, guys. I couldn't help it. I'm so sorry.
Oh, we are getting a lot of responses.
Yeah.
And actually,
So many correct answers. Oh my God. I'm learning from you guys.
okay, so many
Yeah,
correct
so
answers.
many correct answers. Burj
Okay.
Khalifa. Yay.
Okay, then one more question to you guys.
Okay.
What do you think? What is the India's largest mountain?
Got it. Kodaikanal. Yeah, I know. No. Kerala.
Stop
Yeah,
it,
got
stop it. You don't know. Leave it.
Okay. Tagaytay. Oh, it's in Philippines. Oh my God. Sorry, guys.
Hey, we got the correct answers.
Wow. Yeah. Correct answers. K2, Himalayas.
Okay. Now, promise, one last question.
Okay.
Please tell me, what was your most nostalgic childhood snack?
Okay.
Like, which you really crave? That's something which you really want to eat. What was your most nostalgic snack?
I can do that. Ask me.
What was your?
Thank you, Mayank. Thank you for voluntarily asking that question. I love this thing. Bites. Yeah. I was about to say bites. Someone typed bites. Thank you, guys. High five, up five. Yeah, I love that thing. It's filled with the chocolate, creamy kind of thing. It's a puffy thing. I just loved it. Yeah, what's yours?
I think I have to say pizza.
Classic.
It's my all-time favorite. Yeah.
Classic, yeah.
Yeah.
Okay.
So, would you like to guess what's India's most popular snack?
Easy. Pav bhaji.
No. Forget it.
Vada pav.
Forget it.
Pani puri.
You don't know. Forget it.
Murku. Sevu.
Now,
Lace.
no. Forget it.
Kurkure.
Leave it.
Cheetos.
Okay.
Ah.
To your surprise, guys,
Oh my God.
India's most popular snack is not bhujia.
Ah.
It's not even samosa. India's favorite snack is Dolo.
I was this close.
That is painkiller, paracetamol. According to IQAVI, at least 3.5 billion tablets have been sold since the beginning of COVID-19 pandemic. 3.5 billion. Do you know how many of that is? If you stack up all the tablets, all the Dolo tablets, the Dolo tower will be taller than the Burj Khalifa. You know, to be more precise, it will be 63,000 times taller than the Burj Khalifa.
Wow.
And it will also be 6,000 times taller than the Mount Everest. Such is our towering love for this tiny tablet. And the question is, why? Dolo 650 is a painkiller. It treats symptoms such as headache and fever. But still, why did we consume 3.5 billion of these tablets? Were we that much sick in this last 2 years? Were so many of us sick in this last 2 years? I don't think so. Did doctor tell you to take so many of these tablets? No, again, I don't think so. So what we did what we do best, self-medication. So ladies and gentlemen, that's the focus of our today's webinar, Googling your symptoms and self-medication.
Yep, that is our keen focus for this our webinar, guys. So let's move on to our video presentation. It's easy. The word it's easy. On most days, I hear myself say everything's easy. If you want to check the weather for not only today, for this entire week, it's easy. If you want to contact people or share something to your friends or families, it's easy. If you don't want to feel like cooking, but you're damn hungry, getting or buying food, guess what? It's easy. So if you want to reach some location, if you don't know anything about their neighborhood, but getting there is easy. So what we learn from this, everything's online, especially by Google. We get provided, consent, delivered according to our needs. So in that order, people got confused and added advice in that list, especially medical advice. If you are feeling something or suffering from something simple, minor or major symptoms, getting advice or getting even medical prescription by Google, it's easy. So now I'm going to leave this thought unto you guys. Getting medical advice or prescription from Dr. Google, is it right? Or we're going to learn the stuff, I guess. So I would like to quote something here, I guess. A person of responsibility can trust himself to choose the right thing over the easy thing. A person of responsibility can trust himself to choose right thing over the easy thing, said by John C. Maxwell. Let's watch this video, shall we?
Hello everyone. Let's discuss about Dr. Google and self-prescription. In today's era where internet has dramatically revolutionized, more than 3.2 billion people have access to internet worldwide. And so is any information about health or disability available over there. To gather health related information, 56%, that is more than half of the population uses internet, also known as Dr. Google anecdotally. So basically, what do we mean by self-medication? It is when we select and use medicines by ourselves to treat a self-recognized or self-diagnosed conditions or symptoms without consulting a physician. For example, you had a heartburn or chest pain, which you self-diagnosed to be acidity and took antacids, which gave mild relief. But this could also be an early manifestation of heart attack, which could be fatal if not diagnosed and managed timely. Now this is a pie chart representing statistical worldwide prevalence of medication. South Africa constitute about 14%, followed by US, Australia, Germany and Spain. So we all can clearly see that self-medication is most prevalent in developing countries. In economically deprived communities, self-medication is very common. This can be related to the fact that in many developing countries, prescription drugs are freely available over the counter. Also, in a developing country where consulting a doctor is unaffordable, people would prefer to self-medicate with a natural or over-the-counter alternatives. It has its own pros or cons. It is less expensive and time-saving, but at the same time, there is always a risk of incorrect self-diagnosis and adverse health effects due to irresponsible self-medication. These days, healthcare facilities are not even accessible. Hence, self-medication have become an obvious choice of the population. Prescriptions are subjective to the rules of the country where they are dispensed. Many drugs that can only be purchased with prescription in developed countries are available over the counter in developing countries. For example, painkillers like acetaminophen, ibuprofen, naproxen are available over the counter in India. Proliferation of over-the-counter drugs market to treat highly prevalent diseases is the direct consequence of lack of medical regulation, especially in developing countries. Hence, there is a need to augment awareness and implement legislations to promote judicious and safe practices. Prevalence of self-medication is 37 and 17% in urban and rural areas of India, where fever, headache, and abdominal pain are the most common illnesses where self-medication is being used, and telling the symptom to the pharmacist is the most commonest method adopted to procure drugs by the users. Do you know, over-the-counter drugs market is worth $7.62 billion. It is betting on half-baked knowledge and incorrect use of over-the-counter medicines, which leads to health risks such as adverse side effects, drug interactions, and overdose. For example, paracetamol is the most frequently used drug in overdoses, predisposing to the risk of acute liver toxicity. India is the largest consumer of antibiotics. In year 2020, 16,290 doses of antibiotics were sold. So basically what we know is that antibiotics kill bacteria or prevent them from reproducing and spreading in our body. But have you ever wondered about the side effects that comes along with its use? Self-medication is a global phenomenon and potential contributor to human pathogen resistance to antibiotics. Overuse of antibiotics has led to antibiotic-resistant strains of bacteria. This killed over 1.2 million people in year 2019 and over 3,500 people per day. Just to give you a rough idea, nearly same number of deaths occur due to road traffic accidents. These figures clearly indicate the alarming concept about overuse of antibiotics, which in turn is preventable if we consult a doctor for prescription rather than self-medicating. According to recent studies, the resistance rate of E. coli to new powerful drugs is 82% in India. Based on the current studies, Filipinos would rather Google medical information and self-medicate than consult a doctor. A 2021 Wellness Index, which was conducted by Health Maintenance Organization PhilHealthcare, found that only 7.4% of 1,500 respondents do not self-medicate. Almost half of the respondents were not comfortable consulting a doctor online or over a phone. Another 39% didn't prefer to spend on a new consultation to get prescription refills. If we look into this prevalence chart based on how often Filipinos self-diagnose and self-medicate, we can clearly see that majority, that is 28.9%, have sometimes self-medicated because they have been able to treat themselves before and have been able to seek advice from friends and search online for medical information. All this statistical data clearly indicates towards the predominance of use of Dr. Google and self-prescription. There is high prevalence of health misinformation on internet followed by public health issues. We need to rethink the way health is delivered, especially under this so-called next or new normal.
So, why do people self-medicate? Listed below are the common reasons why self-medication is preferred by people over clinical consultation. Previous successful experience, which means the person was successfully able to treat themselves in the past, is one of the most common reasons, accounting for about 34.4%. For example, let's just say a person is suffering from headache and he took some over-the-counter drugs and that led to relief of his symptoms. This makes him more likely to take over-the-counter drugs the next time he gets a headache rather than to consult a doctor. The next reason is minor illness, accounting for about 25.7%. For example, if a person is experiencing an illness which is perceived by the person himself as minor, he would prefer to self-medicate rather than to take an effort to consult a doctor. The next one is emergency relief or quick relief. Nowadays, people are extremely busy all the time, so they might prefer to self-medicate for convenience rather than consulting a doctor. This saves their time, effort and money. Also, most often patients may prefer immediate relief of symptoms, which is offered by certain over-the-counter drugs. And lack of immediate relief after consulting a doctor may also cause some patients to lose their trust on doctors, causing them to rely on self-medication more. So, what are the common sources of information of self-medication to people? According to a recent study, as you can see in this chart, family and friends are the most prevalent source of self-medication, accounting for about 38%, which is followed by previous experience, advertisements, internet and social media. Other factors influencing self-medication include growth of the aging population. For example, elderly people would prefer to self-medicate and use some natural alternatives rather than to consult a doctor. The next one is restricted access to healthcare services, which is often found in rural areas. Increasing cost of healthcare can be the next one. Then, high proportion of uninsured or underinsured people, especially in developing countries, due to lack of equality in the distribution of healthcare services. And finally, easy access, convenience and cost effectiveness, since self-medication could be seen as much more convenient and cost effective by most people. Now we'll move on to social media and mental health. Social media has various advantages, like it has given people a voice to share their personal health related remedies and stories. Do you know the number of active social media users increased in 2021, that is during the pandemic? This raises the question of how people may be influenced by what they see online and how it may affect their health choices. For example, you may have often seen that people actually follow and idealize health remedies and information posted by unprofessionals on social media, like Instagram for example, rather than consulting a doctor. Based on a survey conducted in 2018 about internet use, over 12% of users reported feeling anxious or depressed, frustrated or angry. At least some of you might have experienced this, like you're checking your cold symptoms online in WebMD for example, and in turn you find out that you have hepatitis B with a side of cancer. Social networks have also enabled people with mental health problems to feel unity, for example, by sharing their experiences and supporting each other. However, this may have also contributed to self-diagnosis and potentially self-misdiagnosis of mental health issues. This can put people at serious physical and mental health risks. For example, the word depression is often used these days by many whenever they feel low, but in reality it is a clinical term and shouldn't be used so casually. It is never ideal to Google your symptoms online, as it is commonly said that you may go from a slight headache to even clinically dead in just a few clicks. At the end of the day, the reality is that online self-diagnosis cannot be prevented completely in this era of technology and social media. So what can we do about it? We should confirm information found online with a healthcare provider, and it is also very important to ask healthcare providers for credible online sources of information about their diagnosis. Those consulting Dr. Google should be aware of the potential risks associated with it. So what are the risks associated with relying too much on Dr. Google? It can be divided into those which are present at the individual level and those at the community level. The risks at the individual level includes, the first one is hypochondria. Hypochondria refers to a person's anxiety and fear about their health that is created or exacerbated by using the internet to search for medical advice. The next one is incorrect self-diagnosis, which in turn results in incorrect choice of therapy and drug. The next one is risk of abuse, then failure to recognize the contraindications, precautions, warning and interaction of certain drugs, incorrect route of administration and incorrect dosage of drugs, and risk of food-drug interactions. All these could result in fatal consequences.
What are the community level risks? Improper self-medication result in increased drug-induced diseases. As far as common drug-induced diseases caused by the most common suspected drug and class were concerned, various studies recorded cardiac diseases, hypertension, gastrointestinal condition as the most common drug-induced diseases result due to the anticoagulant treatment and use of non-steroidal anti-inflammatory drugs. Self-medication leads to the huge festival of public expenditure and resources. Let me explain you with an example. A woman was struggling with a fatigue for weeks. Instead of seeking the doctor's advice, she turned to the internet. Every site indicates a potential diagnosis is a systemic exertion intolerance disease, that is a chronic fatigue. She tried to combating this herself by ordering supplements that claim to provide relief. Unfortunately, this didn't work. After she had already spent so much money and time trying to self-cure, she visited her doctor, who did a blood test. It revealed that she had anemia, easily treatable with the correct supplement. Let's move on to the antibiotic. Antibiotic can be considered a non-renewable resources for the body since their effect reduces on their successive use. Patients who do not finish the entire course of antibiotics run a higher chance of developing resistance. Patients frequently stop receiving the treatment as they start to feel better. The regular and incorrect administration of antibiotics for self-limiting diseases such as common cold, flu-like symptoms, diarrhea, sore throat, is recognized as the most significant contributor to the antimicrobial resistant growth. The resistance has increased organism virulence and led to the widespread prevalence of diseases caused by the bacteria. The danger of searching symptoms on Google is real. More than half of the people who Google their symptoms online end up misdiagnosing themselves with serious diseases, leading to anxiety and stress. Consequently, people end up taking self-prescription available online, leading to the potential hazardous effect on health. The danger of self-medication is real. The potential risk of self-medication practices include incorrect self-diagnosis, delay in second medical advices when needed, severe adverse reaction, incorrect manner of administration, incorrect doses, masking of severe diseases, and risk of dependence and abuse. The danger over medication is real. The more medication you are taking, the higher the risk of those drugs interacting dangerously with each other. Painkillers are not our best friend. They can be harmful, especially when taken incorrectly. The most common side effect is stomach. Example, pain has been linked with the stomach ulcer. Things we should ask ourselves before self-medication. Have you ever thought which chemist warned us about the side effect of medicine before selling it to us? For example, you have muscle pain and you went to the local chemist, described your symptoms, and you were given a dexamethasone by him, which is the steroid. Do you take steroid without knowing its side effect? Side effects such as blurry vision and immune suppressant leading to the lower resistance to the infection. Have you ever questioned yourself which WhatsApp group tell us about over-medication and its adverse effect? Disinformation messages can be disseminated in form of memes, fake news, manipulated photos or videos, propaganda or hoaxes. They are somewhat outrageous, resourceful, dramatic and sensational content. They capture the attention and ideally the imagination of public and are basically spread as a private hoaxes. Dissemination of such false information is the promotion of erroneous practices that could be ultimately harm people's physical and mental health. Which neighbors tell us about the antibiotic resistance? Due to the overuse of antibiotic, it had led to the antibiotic resistant strains of bacteria, due to which infections like pneumonia, tuberculosis, gonorrhea, salmonellosis are becoming harder to treat as antibiotics used to treat them become less effective. How does medicine interact with our food and existing medication? When you take medicine, along with the food, the effects are increased and decreased. Regarding food-drug interaction, physicians recognize that some foods and drugs, when taken simultaneously, can alter the body's ability to utilize a particular food or drug, or cause serious side effects. These interactions may occur out of the accidental misuse or due to the lack of knowledge about the active ingredient involved in the relevant substance. Horror stories about COVID self-medication. Let me tell you the story from Dr. Rahul Agrawal. A few days ago, he came across a patient who had taken every antibiotic he knew for fever and sore throat and came to him after 5 days saying that he is not feeling better. Since he had taken everything, doctor told him that he is prescribing him paracetamol, which is the only medication he has not taken yet. The next story is from Dr. Ashwini Goyal, which tells us how patient self-medication lead to the loss of his own life. The patient took one of his family members' prescription, which was written by the pulmonologist, and started taking those medications straight away, instead of consulting a doctor. By the time he came to Dr. Ashwin Goyal, his oxygen level has been dropped to the 72%. Dr. Goyal has referred him elsewhere. Later, doctor found that the patient was died. How can we stop self-medication? Self-medication harms the health and well-being of individuals and communities. Addressing them requires the implementation of effective strategies. Highly effective community-based prevention programs and policies exist and should be widely implemented. Unfortunately, social media platforms are also highly susceptible to misinformation due to the low cost access, virality of posts, individual trust in a social network, and the high cost of fact checking. Information from trusted social media sources can shape knowledge and behavior when misinformation and mistrust are widespread. Specifically, we examine the effectiveness of WhatsApp messages from trusted civil society organization in Zimbabwe aimed at targeting the misinformation in the context of COVID-19 pandemic. As a responsible citizen, stop forwarding the misinformation in the form of WhatsApp messages. Make verified medical professional more accessible. Trust the expert and not the Google to treat yourself and someone. Make healthcare more affordable, such as the Government of India has launched Janani Shishu Suraksha Karyakram to motivate those who still choose to deliver at home rather than to opt for the institutional deliveries. Although 40% of adults says that they borrow or lend prescription drugs. It's very dangerous to do. Understand the risk of sharing the prescription drug. Dr. Google and self-medication is alarming concept. This reviews the focus of self-medication of allopathic drugs, their uses, their safety, reason for using them. It would be safe if the people who are using it have a sufficient knowledge about its dosage, time of intake and side effects of overdoses. But due to the lack of information, it can cause the serious effects such as antibiotic resistance, skin problem, hypersensitivity and allergy. Self-medication is common in developing countries where it has both economic and social implications. To understand the same, a detailed systematic literature review based on survey findings on self-medication in developing countries was carried out. From a total 52 survey articles, 25 surveys were selected for the present review. From the survey outcome, it was found that the cost, time and past experience with the medicine and symptoms were the key determinant, while the healthcare professionals emerged to be a primary source of information knowledge for self-medication and practices. Hence, it is recommended that holistic approach should be taken to prevent this problem, which include proper awareness, education regarding the self-medication, and strictness regarding the pharmaceutical advertising. Dispensing modes need to be improved through the proper education and strict regulatory and manageable strategies to make healthcare easily accessible and cost-effective. Health professionals have spent some extra time in educating patients regarding the same. Improved knowledge and understanding about self-medication may result in rational use and thus limit emerging microbial resistant issues. Google is almost always wrong. Many people turn to Dr. Google, self-diagnose their health symptoms and seek medical advice. But new research shows online symptoms checker are only accurate about a third of the time. The biggest reason that you should never Google your symptoms is that you are not a doctor. We don't say this is to be flippant or dismissive. There's a reason we trust doctor with the most vulnerable and frightening moment in our health journey. Conclusively, Google is a great search engine for information, images, news, photos, but not for the medical advice. Thank you for being a wonderful audience. We have heartily grateful that we got the chance to explain and discuss Dr. Google with you all.
That was an amazing and wonderful presentation.
Wow. But there's so much complex stuff. They're saying you should do this and that and that and this. Just look at our audience. They got so confused and bored, including me. No.
Wait.
Okay.
We really have to deal with that. So now we'll like to invite an ENT specialist
Who's gonna simplify all of our presentation into simpler terms. Let's welcome Dr. Henrik Whitegren, everybody.
One evening my father said, "My son, I'm dying and soon I'll be gone. But before my final farewell, hear me and hear me well. Do whatever you want to do. Have a plan or roll the dice. But one thing is strictly taboo. Please follow my advice. Never Google your symptoms. That is my only prescription. You get 100 diagnoses, a medieval prognosis. Every sign is a serious condition. If you Google cough and diagnosis, you have got tuberculosis. And if you Google fever and red, you've got Ebola and soon will be dead. And if you Google I have a runny nose, it's CSF, your brain is leaking juice. And if you Google itch and prognosis, anaphylactic shock or psychosis, Never Google your symptoms. Seldom it brings any wisdom. You want to discover, but you might uncover that you have an extra chromosome. So this is what I heard my father say. And then he closed his eyes and passed away. The autopsy report was very clear. Death from hypochondriac fear, which is custom when you Google your symptoms. Never Google your symptoms. The hit list is never awesome. Pain in your left arm, heart attack alarm. Do you feel a little weak? Yes, you got ALS. If you have a slight anemia, you've got leukemia. Are you a little crazy? You've got ADHD. So never ever Google your symptoms.
So never, guys, never Google your symptoms.
That was an amazing, amazing song. Really amazing song.
Yeah, I enjoyed. Hope you guys are all enjoying. Yeah,
Okay. Now let's dive into some serious stuff again.
serious stuff. Okay, okay,
Not that serious. Don't worry. Not that serious.
okay. So we'd like to welcome, we'd like to invite Professor Dr. Erwin Fowler is the Director of Internationalization and Linkages Office of San Pedro College, Philippines. He's a visiting professor of Bournemouth University, United Kingdom, and the Fellow of Royal Institute of Pharmacists, Singapore. He is a multi-awarded researcher published in Scopus ISI Journal and author of several books. So I'd like to call upon the most respected, renowned pulmonologist, Professor Dr. Erwin, to share his perspective about getting medically advised and prescribed by Google and his thoughts and concerns.
Yes, thank you very much for the MC. And I think this is a very exciting seminar that you have and training that you have in collaboration then with medical doctors here in the Philippines and also in the University of Perpetual Health. I think this is a very good experience for the students to really tackle and to be with our experts here. And I love actually the rock star medical doctor who's actually telling us that do not Google your symptoms. A while ago, there was actually a video presented with regards to the accessibility of a lot of medical information. I think there are almost 3.2 billion that was mentioned who can actually access medical information in the internet, even in the Google. There's a lot of actually of the platform that we can search on, not only Google but also Wikipedia, Yahoo Health, and other informations that we can really Google in terms of medical symptoms or even medical information. Nevertheless, that if we can Google certain information, it is very accessible. Accessibility is quite great. And of course, people really are very curious on what they are searching and how accessible it is, the information to the public, to the people with regards to Google, Yahoo Health, and even Wikipedia. It's very, very accessible to the public. And that is where I think this is very evident on what is the public health is in the Philippines and even also in India, how accessible we are as a healthcare provider. And of course, it really manifests in terms of the healthcare system in the Philippines and also in the developing country. And most of it, remember that our healthcare system in the Philippines are quite very commercialized. There are a lot of private institutions rather than in a public healthcare that are quite very inaccessible to the people. And this is actually very important, where the government actually need to put a lot of more accessibility to the people, especially on healthcare, especially on accessibility to healthcare provider, and of course, accessibility to the medication for the people. And it was also mentioned a while ago about self-medication and of course the definition of self-medication and of course availability of over-the-counter medication that cannot be only available in the pharmacy, but it can also be accessible through an online format like Zalora, no, and of course Shopee, and a lot of commercialized online pharmacy that may be not actually registered by the Food and Drug Administration. Some of them are fly-by-night. You can just see them in an online format. You can see them via an internet, which are not actually prescribed by the medical doctors and healthcare professionals. We need really to increase the awareness and the knowledge of the people instead of trying to neglect in terms of the information to the public, because the people, we cannot deny the fact that people in just one click of a second, they can even have accessibility into the internet. And that is why they don't want to go to the medical doctor or any other healthcare professional, because they can have information at the click of their fingers. And that is why we as a healthcare professional, we need to be, number one, to be accessible to the people. Number two, we need to be giving them information rather than neglecting in terms of their curiosity. Give them the correct information. Give them, like for example, website, they can actually Google on it and search on correct information rather than neglecting information to them. And of course, number three, try to have a lot of more time to your client, to your patient then, because giving them more time, trying to actually fulfill in terms of their curiosity. And of course, some of them are quite ashamed in terms of their illness, especially with sexually transmitted infections and others that can be done by the medical professionals or by healthcare professionals. Because of their curiosity, we'll be able to fulfill them. They cannot even go to the Google and search it because we have already fulfilled in terms of their curiosity. And of course, we are there as a healthcare professional that are accessible to the public then. There's a lot of things that are going on in terms of searching with Google because, of course, it is a manifestation of what is then of the public health in the Philippines that are quite very expensive, inaccessible to them, and of course, a lot of things. No? And that is why we need to be available. And that is a manifestation that our healthcare must be actually not expensive and available to the public then. And that is what the government is working to become more accessible to the public. And that makes it cost saving for the public instead of, like, for example, too much of the healthcare costs because of the out of the pocket that is manifesting here in the Philippines and also in the developing country. This can be diverted then for their, like, for example, education. This can be diverted into other needs of the people then. And that is why it's very important that we, as a healthcare professional, even you are in India or in the Philippines, that we need to be accessible to the people then. Of course, with this, there's a lot of disadvantage that was mentioned in the video that was presented by our presenters. And one of it is actually self-medication that will cause antimicrobial resistance. And of course, as we Google of it, top 10 that are very curious of people that are searching via Google is one is actually antibiotic. Number two is actually antipsychotic agents that deals on mental health. And of course, pain relievers, NSAIDs, and steroids that are oftenly been Googled with all of these things. And that is why manifestation of antibiotics that are been in the Philippines And that is why the regulation of the Food and Drug Administration in the Philippines mandated that they need to have prescription before they buy into the pharmacy. And we as a pharmacist really follow the Food and Drug Administration that without your prescription as a medical doctor, we will not release in terms of the medication or antibiotics because we all know that it may cause with this antimicrobial resistance. As we all know that mental health is very evident nowadays after pandemic and of course before pandemic, and it's skyrocketing nowadays. Through this mental health, I've had a lot of patients through the Association of Medical Doctors in Asia, led by Dr. L. Ray Navarro and the team of the medical students also. We have consulted with during the time of the COVID-19, we have the national free online consultation, and it manifests there that a lot of people actually just Google without medical attention and prescription. And that is why main objective of the national free online to make it accessible. And we have thousands of patients that we have encountered then, and that really help the people. And that is the way that we are looking forward in terms of the free medical consultations that we have for the people. And we have found out that there's a lot of mental health challenges of people at the time. Anxiety, depression are very evident. They just Google and they try to be anxious because they undergo self-diagnosis with it. And that is really the manifestation of what is the public health that manifests during the time of COVID-19. There's a lot of things as mandated by the World Health Organization in terms of self-care. And this is really evident that we need really to move forward in terms of our healthcare, empowering our patient. Yes, I call it empowering our patient of information that coming from us, reliable healthcare professional, giving them information, not fake news, but information, correct information to the public with regard. That is why TikTok, now YouTube, and other modalities are very, very important in this new generation. Will be able to create new information, correct information to the public that we as a medical students, healthcare providers will be able to spread, yes, love in terms of our information, love of the correct information, not fake news. You, yes, all of you that are here will be able to share information. This is one way. I really admire the group headed by Dr. Andre and Dr. L. Ray Navarro and the team of the University of Perpetua Health and also the medical student for spreading not the fake news, no, but correct information to the public. I know that we are live right now via YouTube and other social media platforms, and this is the way forward in terms of spreading to the people, not to have self-diagnosis or self-medication. That is a no-no, no? But then telling them that we are here as a healthcare provider to be able to help them in terms of their diseases. Whatever it takes, do not Google. Try, we are here, accessible for the people. And I think that's all for me. I'm Dr. Erwin Martinez Falier. Any help that we can give not to the public in terms of medication and of course self-care, we are here for you in terms of our public health concerns that we have. Thank you very much for this invitation.
Thank you so much for your appealing words, Doctor. Really, really, thank you so much. And we really like to thank you once again for joining with us and sharing your really wonderful thoughts with us, Doctor.
Yes, doctor. That is so true words that you put right there. And thank you for the encouraging words, doctor.
And we'll really will follow your advices, definitely. And as much as possible, we'll try to do this more webinars more and more so that we can spread this knowledge more and more with more people in the public.
Yes, doctor. Thank you for the thank you once again for joining us and sharing your thoughts, doctor. Now we'd like to invite one of the most respected and renowned and experienced gastrointestinal and hepatobiliary surgeon in India, Dr. B.K. Sood, to share his valuable conviction upon our webinar.
Yes, sir. Good evening, sir. So we are conducting this webinar on Dr. Google and self-prescription. What we have been seeing so far is that nowadays, as so much advancement have happened, in terms of Google, in terms of internet, so many people are searching their symptoms directly online, and they are just checking their symptoms and not going to doctors and even taking their medications by themselves. So how do you feel about it? What's your point of view on this?
So selecting a symptom and contacting a doctor, it is a good thing. But if you go for self-treatment, it is the wrong thing.
Yes. So, sir, while like patient comes to you through Google and all, so what was your how do you react to that knowledge and all? So how will you react?
It's a good thing. If the patient is intelligent, he wants to know the diagnosis. It is good we discuss with them and we try to convince what is the problem, and accordingly we go for the diagnosis. If they need any investigations and all, depends on the patient behavior and mental status. If you believe the doctor, you can discuss your symptoms and diagnosis with the doctor. And if you don't want to discuss, then you will go into the mess. You may be right, you may be wrong.
Yes, sir.
So it is always better to discuss their symptom with the doctor, not start taking your own treatment.
Yes, sir. That was the main issue, and we have been seeing in like the research which we did, we have been seeing that the patients usually what they are doing is that they are taking the self medications, like let's just say antibiotics. They are taking the doses of antibiotics and then stopping just by taking one after 1 or 2 days, and which might be causing antibiotic resistance. So how often do you see such cases?
Very frequently, not much frequently, but one or two patients a day you can see like this. They are taking medicine, they are overdosing or underdosing, or they are taking unnecessary steroids. They are very common this thing. At least in my practice, where the patients, 60% of the patients are uneducated or less educated.
And sir, how do you think is affecting their health?
Yeah, it is very badly affecting their health because they develop with antibiotic resistance, the steroid, they become dependent on the steroids, then becomes very miserable condition.
And also, sir, in India, especially on this only, the antibiotic resistance, does Indian government give any guidelines to a general public on that?
Yeah, they definitely do it. They definitely give the guidelines to the people. I said most of the people are uneducated, less educated. They live in the villages. They usually doesn't know about it. Then the instruction of the government doesn't reach there properly. And they don't understand this thing, importance of this thing.
And so, in your point of view, how can we deal with this? Like our purpose for this webinar is to reach as many people as possible and educate them regarding this situation. So what do you think, how we can deal with this situation which we are facing currently, especially in India?
First, you have to educate the people. Secondly, there are many ways, electronic media, print media, and other things we can use, and we can make a mass contact with the people in public meetings. You can have a gatherings of different groups, different associations, and ask them to convey the messages.
Okay, sir. Yes, sir. So that was the things which you wanted to discuss with you, sir.
Yeah,
Thank you.
thank you.
Thank you, sir.
Thank you so much, Doctor, for your on-point answers and your opinions about the topic. And thank you once again for sharing your thoughts.
Yes, Doctor, that is so on point. So hope you guys learned so many things about the self-prescription. And not only that, we got so many advices from our experts today, I guess. And to mention this, guys, we're very much happy to give credits for the actors and the rightful owners of the contents which we used for this webinar. So here's our credits and thanks for the rightful owners of the contents which we used for this webinar. And after the long wait, here's a brainstorming session, guys. So we've got so many responses and concerns towards our topic of Dr. Google, self-prescription. Cure doesn't lie in a single click or touch. And we'd like to thank you guys so much for your amazing and astonishing responses and thoughts. He is our fellow international medical clerks, panelists, Dr. Alam, Dr. Parth, and Dr. Pavitra, are to answer the questions which you people asked. And for once again, if you want to add some questions or queries, all you have to do is just type your questions into the account name Q&A. Yeah. So for here to start the ball rolling, here's a question for you, Dr. Parth. What are the advantages of Google, since we Google sometimes for fostering?
Okay. Hello everyone. Okay. So see, if we, I think my voice is echoing right now. Okay. So see, people seek for the fast response and relief. Instead of Googling things, we can do, teleconsultation like Practo in India, and there is an app in Philippines also, CU Doc, and there you can consult to the real doctors. Where they will diagnose you, and they will, like, you can talk to them on a video call, phone call, or a chat box, and it is very useful instead of using the Google. Thank you.
So
thank you, Dr. Parth.
Yeah, thank you so much, Dr. Parth. We got so many responses like stop texting us, guys, how to become a doctor in 30 days. That's not going to happen. And how to sleep 8 hours in 1 hour. That's not going to happen, guys, forever. So the second question for Dr. Alam, since I have smartwatch and health app to monitor my health, why should I have to go to doctor for regular checkup? That's a nice question.
Yeah, that's a really nice question. Oh, yeah, that's a really nice question. And good afternoon, everyone. And good afternoon, doctor and hosts. So it's a really nice question. So the answer for that is like these digital instruments which we use like a smartwatch or smartphones, they're not very accurate. They are very precise. So you should only use them for your screening purpose only. Like if you want to have screening for mass population, you can use them as a screening purpose, but they are not diagnostic. You should not use them. You should not use their reading to diagnose yourself, self-diagnose. Like in smartwatch, if you have a ECG function, and if you see if it is showing any abnormalities in it, you should not directly take medicine, start taking and all. First, you go to your doctor, personal doctor, and you should consult them, and then you, through the doctor only, you go further only. So this is my answer. Thank you everyone. Thank you for asking the question.
Thank you so much, Dr. Alam. And here I'd like to ask the next question to Dr. Pavitra. Here's a question we got. What should we do when there is an emergency situation like snake bite? Shouldn't we search it on Google and give first aid because of less time?
Good afternoon, everybody. I would like to answer this question by giving an example of an instance which happened in India. A patient came in with his relative having a snake bite to the hospital. The patient's relative told that he had given him first aid. And we were inquired like what was the first aid he gave him. He told that he used a shaving blade and cut his arm and tightly tied a rope around it, applied some lime on it, and took some milkweed plants and extracted the milk from it and applied that also. On top of all of this, to prevent the poison from getting into his brain, they gave him dung of a donkey mixed in water and gave him orally as well. So, do you guys, all the people who are in the meeting from India, do you think this is the first aid to be given to a snake bite victim? No, not at all. You're making the patient life even more riskier by giving improper first aid and searching it online and doing home remedies. The actual thing, what you have to do is you have to just leave the wound area as it is, remove all the tight items, do rush the nearest to the nearest healthcare facility for medical treatment. You know, many snakebite victims die because of improper first aid and not bringing them on time to the hospital. So I think the solution for this doesn't just lie here. The people have to be educated about the basic first aids to be given during emergency situations by creating awareness using TV ads or setting up a campaign in rural areas, because those are the people who do all these things. The rural area people who are not much educated and not aware about the first aid things. So that is our concern as a medical students, and we have to set a campaign in rural areas and educate the people.
Thank you so much, Dr. Pavitra. That is some valued information that we got from you today. So we'd like to inform you guys that due to our limited time that we couldn't answer all of your questions right now, and we do apologize for that. And thank you so much again for your astonishing responses, guys. So
okay. Now, before leaving the Q&A sessions, I'd like everyone to from your audience to open your cams for the picture, for the documentation purpose.
Yeah.
Everybody open your cams so we can take the picture for the documentation purpose. Who's taking the?
Everyone, please turn on your camera as we taking pictures for our documentation. Yeah, we have to go page by page, so do bear with us. 3, 2, 1. First page done. And second page, 3, 2. Thank you so much, guys. Thank you so much for your cooperation with us today. So, and to mention one more important thing, people, we'll be posting the link for the feedback about this webinar. We request you people to kindly fill it as we speak. Like, your feedback about this webinar is very much appreciable. So kindly, please fill that form up.
Okay. And now we'd like to invite our webinar coordinator, Dr. Navarro, for the closing remarks and share his thoughts. Webinar.
Okay, good morning, everyone. Can you hear me clearly?
Okay.
Yes, doctor.
Yes, okay. Good morning. I'm actually giving my message live here in Kazakhstan. So this is indeed a very interactive and very interesting morning, because as you have seen, based on our webinar, that we have learned a lot of things today. It is clear that healthcare is actually a knowledge-driven profession. The spread of false and misleading health information has increased substantially over the years, especially during the pandemic. That contributed to the use of unproven treatments, non-adherence to the health measures, and high levels of vaccine hesitancy, and even public confusion and anxiety. And thus, we as doctors, along with our pharmacists, nurses, medical technologists, and other healthcare professionals, these are actually our obligation to do our part to combat the misinformation in the community. And this is precisely why we are actually having this initiative. They always say that the culprit is the technology or the social media. But we can actually not put all the blames in social media or technology. We could actually make it improve how to communicate our message in a very simple and understandable manner by explaining to them simple terminologies, and also trying to be more emphatic of what they actually would like to say. So it is also our obligation that whenever we use our social media like Facebook or Twitter, to always check the legitimacy or the validity of the information we share in our wall, like making sure that it is actually coming from valid resources, references, because everything that we post, everything that we share in our social media, we should also be accountable. Okay? So this is what we're actually telling our students. So at this point, I would like again to thank everyone who actually took time to join our webinar and hear out the medical interns of what they actually would like, and clerks, what they actually in store for us. They put a lot of effort, they put a lot of hard work to coming up with this very engaging and interesting webinar. And congratulations to the organizers. And I am sure that your families and your friends are truly proud of what you are actually able to share with us today. Okay. Thank you to our speakers, to our invited guests, and to our department chair, Dr. Andres, for also giving us opportunity to come up with this very engaging activity. Thank you and have a good day, everyone.
Thank you so much, Doctor, for your enchanting words and thoughts you've put. And thank you guys for filling the form, like feedback form as we speak. And thank you for the positive responses. And before we ending this amazing session, we'd like to extend our utmost gratitude and heartwarming regards to our guest speakers, Dr. Edwin Fowler and Dr. B.K. Sood from India, as well as our department faculties and mentors, Dr. Audrey Andres and Dr. Eldre Navarro. And thanking is not enough for the amazing, wonderful audience that we got today. That is you guys. Thank you guys all once again for making this webinar happen. And
it's really hard to say, but we have to end the session now. So it's time to say good wishes and goodbye to you all. It's me, Sharma Mayank.
And this is Samuel Sam Jr. We're signing off as your hosts, and stay safe. May God bless us all.
And please stop Googling your symptoms, talk to the doctors.
Yeah, we spent 2 hours, guys.
Please, please, please listen to us and stop Googling your symptoms.
Thank you, guys.
Thank you, guys.
Thank you so much. Stay safe.
Thank you.
Okay, bye everyone. Medical interns and clerks, please join another session for our debriefing. Thank you. Bye.
Thank you. Thank you, Paul.
Bye.